First of all, I'm incredibly honored to be receiving this award, and I am a huge fan of the work that NCADA does, not only individually but collaboratively with folks in the region. And I think your work catalyzes so much of the great work that we've seen happen in our community. So with our Addiction Medicine Fellowship at St. Louis U, when I left correctional healthcare, which is a whole nother conversation, about almost 4 years ago, that was right at the time that addiction medicine took off as its own specialty and accredited by the powers that be in healthcare. And I knew right off the bat I wanted to start a fellowship at St. Louis U because my career has been involved with working with folks who were homeless, working with incarcerated populations, and then all of those areas really have a current of substance use disorder and mental health, especially untreated substance use disorder and mental health for individuals involved in those systems. So I started working on what do we need to do to make this happen. So at the tender age of 53, took a second board exam in addiction medicine and started work on how do we build this fellowship. The nice thing is at St. Louis U, I've been working for the last few years on building substance use disorder diagnosis, treatment, prevention into the curriculum in our medical school and also our PA program. So this was very much a natural fit for us. Together with that and our family medicine residency, which is based on an integrative care model, where we partner with family care health centers and also St. Mary's Hospital. Again, natural fit. So I started seeing who were the people at St. Louis U that would be a natural complement to this work. So we started working with Dr. Jay Shiken, who I know has previously received a Pioneer Award with the Wish Center at St. Mary's Hospital. I started working with Dr. Morella Marcoux in our addiction psychiatry program at SLU. And my buddy Philip Wenger, who's a clinical pharmacist. We worked together for 10 years at the jail in St. Louis County, but now we're working together again at ARCA. Pulled our core faculty together, started doing some advertising, got some funding from our state opioid response team for our year 1, and we have funding for year 2, 3, and 4 from Missouri Foundation for Health. So we're up and running now with our first fellow, Dr. Kate Osman. Our second fellow, Dr. John Burnshead, is going to be starting in June. I always say that I use more skills that I learned from being a teacher and growing up in a family business every day than anything I learned in med school. One thing I learned as a teacher, and that was first, well, I can't think of a time I wasn't teaching or tutoring, but formally teaching at Koryezu in the late 80s. And learning that what doesn't kill you makes you more interesting. What has developed over time is learning how to be resourceful and how to communicate with people and realizing that the content is not as important as the connection. And that has grown in decades now because you can get content off your phone. You can get content everywhere. But what makes you an effective teacher is knowing how to connect with your students. And I think that helped me. And what also helped me was the planning that goes into education. You have to know where you're headed. In medicine, we're always learning better ways to do things, but we tend to focus on our patient who's right in front of us. By being a teacher, I had to learn to look at the outcomes. What are we shooting for? What's the bright light that we sometimes need to light for ourselves at the end of the tunnel? And how do we maneuver? How do we use resources? How do we collaborate? How do we bring the right team together to get us to that point? In the Rottnek family, the idea of a hobby is usually a second job. So I knew going into this work, I needed to make sure that if I was doing additional work on the side, that it had to be something congruent with my values and also my time. Because in this field, you can always do more work, right? So there's a couple things that have been refined over the years. One is, I like to be on working boards. I don't like to be on boards where you just rubber stamp things. Number 2, I like to bring content and my experience to the board. I like to work with agencies that will benefit from having a physician or having someone in healthcare on the board. I also like to work with organizations in their early phases to kind of help them get set up and started. With criminal justice ministry, I was on their board for several years, and I stepped off of that to get on ARCHway's board because CJM was in a very solid position in terms of funding, in terms of programming, and I wanted to help bring some of those lessons learned to ARCHway. How do we professionalize the work of the organization? How do we, in a good way, institutionalize the work? How do we create most people don't get excited about policies and protocols. I love them. But how do we routinize the work? How do we figure out ways that we can grow beyond the pioneers? And I like that interface about how do we go from doing crazy, unique stuff to finding a way to do crazy, unique stuff in a sustainable way. So over time, that's been kind of my guiding principles about work on the side is how do we sustain good work and how do we pull the right partners together in a region so that we complement each other rather than duplicate each other's efforts. Part of it is the unique background I had growing up. I was the first in my family on either side to go to college, much less medical school. I felt like a fish out of water, and I still do in many really hierarchical systems. And that chafed at me in med school. And also coming out as a gay man before I went to medical school was something else that even in the early 90s in St. Louis was still atypical. I found a real love for working with folks who are homeless when I was in a mini course as a first-year med student. And part of that helped me realize that it connected me to some of my childhood connections with growing up in a family business, working in a warehouse, going out into the community, delivering hardware and Formica and things like that. That comfort level helped me really realize that there are whole populations of people in our society who don't have ready access to the hospital with the water feature and the marble lobby, right? Well, as time went on, and I learned to listen to people differently to see how I could complement and help them navigate systems, I started meeting people from the Regional Health Commission, the Integrated Health Network, and I started realizing that not only are there whole populations traditional healthcare doesn't work with, but there are whole different ways of seeing the world. And if we want a healthier world and healthier communities, we need to find ways that people can engage different models of leadership. Now that I am well into my middle age, I have the privilege oftentimes of being the only white guy in the room. Or as I like to joke with people, thank God I'm gay or I'd be insufferable. But it's that idea of how do we support people who don't look like me in leadership positions. And I read a great article, and I wish I knew the author's name, but she wrote a brief piece on how to support Black women in leadership. And I pulled something away very important from that. It's don't expect them to be problem solvers, don't expect them to be experts in everything, but one thing you can do is offer to hold their bags for them. And that's kind of become my motto right now at this point in my career. Yeah, there's things I'm pioneering and things I'm pushing, but there's a lot of ways that I used to say you can leverage the initials behind my name to do good work. Now I also want to try to model how can I hold people's bags who don't look like me, open the doors for them, do simple acts that can promote their leadership.
So what keeps you going? This work is hard.
This work is hard.
This work is hard.
My two cats, Michelle and Barack, are right up there. That I did get in July of 2016, so I wanted the Obamas to still be running my house. The other is learning later in life that even if people are not physically in the room, I have a whole community of people that we are working together to add value to this world in this kind of work. And now if I have a day that seems tough or I seem frustrated or I make a horrible mistake, I can think in my head, what would Rosetta say? Or what would Bethany say? What would Angie say? I can think about these folks and say, what would they say to me by means of encouragement to me to move forward? And I think that's a lot of what keeps me going right now. Yes, I would like to thank, first of all, people at St. Louis U to trust me for the crazy work that I do. They welcomed a jail doctor back full-time on staff, and then they supported me in the addiction work. I'd like to thank people at ARCA, Sunil and Percy Menzies, and the team there that have welcomed me with open arms and say, hey, how can we work together to really bring our work to the next level? I'd also like to thank folks at ARCHway for the same thing. How do we work together to promote care of the caregivers for families and individuals with serious mental illness and substance use disorder? And also, how do we work together to really elevate the role of peers? And of course, I also need to thank my sister who runs my life for me when the cats aren't there, or still runs my life for me when the cats aren't there. And my friend Susan Hubbard, a social worker and therapist who was my role model in residency. And since then, I'm Uncle Fred to her kids, who are both in college and grad school right now. So those are my thank yous.
So on behalf of NCADA, I'm presenting you the 2020 Pioneer Award in appreciation of your innovative and transformational impact on the field of substance use.
Thank you so much. It's a real honor.
Thank you.